Hello and welcome back to Elizabeth Shares. Today I'd like to talk about fibrous dysplasia. What is fibrous dysplasia? How has my life been affected by fibrous dysplasia? Fibrous dysplasia is an uncommon chronic bone disorder in which scar-like fibrous tissue develops in place of normal bone. This irregular tissue can weaken the infected bone, cause it to deform or fracture, and cause pain. My fibrous dysplasia, located in the skull base, is expanding and has transformed, requiring surgery and pathology to determine if the growth or mass is benign or cancerous. I am scheduled for surgery at the beginning of March 2021. In general, fibrous dysplasia can affect any bone. The most commonly affected bones are said to include the following: facial bones, pelvis, ribs, shin bone, skull, thigh bone, upper arm bone, and vertebrae in the spine. I have monostotic fibrous dysplasia of the skull affecting one bone in my body. Monostotic fibrous dysplasia is a form of fibrous dysplasia where only one bone is involved. It is said to comprise the majority of cases of fibrous dysplasia. Fibrous dysplasia usually occurs in children, typically ages 3 to 15. It is sometimes not diagnosed until adulthood. It is said to be found equally in males and females. As a child, I knew something was wrong. As a child, as I grew up, I would get terrible pain in the back of my skull, along with what I felt was rumbling that sent sensations into the front of my face and tongue, predominantly on the left side. As I said before, I knew something was wrong. Remember, this is an uncommon disorder. Therefore, while I told my parents I wanted to have it checked out, they told me to ignore it as it was stress-related, or so they felt. So it was left until adulthood to be diagnosed. The exact cause of fibrous dysplasia is not known. It is believed to be due to a chemical defect in a specific bone protein. This defect may be due to a gene mutation present at birth, although the condition is not known to be passed down in families, which means it's not hereditary. The symptoms of fibrous dysplasia may look like other medical problems. Always talk with your healthcare provider for a diagnosis. And please remember, I'm not a medical doctor and I am not providing medical advice. Always speak with a doctor. How is fibrous dysplasia diagnosed? In addition to a complete medical history and a physical exam, other tests may include the following. A biopsy is a test in which tissue samples are removed from the body and looked at under a microscope. It can help determine if cancer or other abnormal cells are present. It can also be done to remove tissue from the affected bone. A bone scan. Your doctor may order a bone scan to look for additional lesions throughout your entire skeleton. During this test, a very small amount of radioactive dye is injected into the body by IV. Lab tests may be ordered. When fibrous dysplasia lesions are actively growing, blood and urine tests may show elevated levels of the certain enzymes and amino acids in the body. Other imaging tests may be ordered. Your healthcare provider may order an MRI or CT scan to further evaluate the affected bones. X-ray, a diagnostic test that makes images of internal tissues, bones, and organs onto film. In my case, my fibrous dysplasia was diagnosed through imaging. I first went for an MRI and then a CT of the head and brain. As an adult, I had sinus infections and vertigo. That led an ENT to request an MRI. The radiologist noted an abnormality and need for a CT. The ENT then sent me for the CT. There was still confusion as to what the abnormality was in my skull. Eventually, a neurosurgeon determined it to be fibrous dysplasia. Fibrous dysplasia treatment may include surgery, medicines, pain management, and/or physical therapy. Through the years as an adult, I went for follow-up scans and continued to be followed by neurosurgeons. The first time I went to a neurologist and neurosurgeon, I was asked many questions and examined. As the disorder is rare, radiologists would hold onto my scans, examining it for days, and doctors would find my abnormality interesting and wonder what it could be, so at times I felt as if my skull was a science project. The first time I was referred to a neurosurgeon, I entered the room to find residents lined up along the walls of the entire room. It seemed to be roughly 30 people. They were there to listen and observe as the neurosurgeon spoke with me. I was shocked at first, but then settled in. Over the coming years, I would follow up seeing a neurosurgeon every few years with visits and additional MRI and CT scans. I truly always believed that I would just be following up and then nothing would happen to require surgery, yet here we are. I'm about to have surgery and during a pandemic. I have lived with chronic skull pain, migraine headaches, ocular migraines, and odd pulling sensations emanating from the back of my head going into the front of my face and tongue, vertigo, odd tingling sensations emanating from the back of my skull, stress related to fibrous dysplasia, and more. I have been able to continue to live life while managing my fibrous dysplasia. You can too. While I've never met anyone else who has fibrous dysplasia, I truly hope that this video helps inspire others and also explains to people what fibrous dysplasia is all about. Thank you.